Eventually, the bacteria will gain the upper hand and they'll get decay in that groove. And I'm not really a gambler, but even I know 95% odds, not good. That's not a gamble I'm willing to take with my teeth, with my family's teeth, with my patients' teeth. They may be willing to take that gamble, but I'm not. Okay? My job is to let them know about every opportunity I see, and their job is to let me know what they want to do about it. Now, I know I'm seeing hands here and there for questions, but I'm going to ask respectfully that we hold off on those because we already started kind of behind schedule. So chances are I'm going to answer your question further in the material. If I don't, please write it down, and after I'm done, I will be happy to answer some questions if time allows. If not, come on up and I'll answer questions until beach time, you know, until we're out on the beach together, and then maybe we'll get it done. We'll get it done, okay? So children and adults, sealants are a viable procedure. So our goal is to recommend sealants on all posterior teeth, not just those that have an insurance benefit. That's our goal, okay? And we do it a lot. So look beyond those permanent molars only, right? Premolar teeth. Sometimes I'll even recommend a sealant on the lingual pit of 7 and 10, if it's big enough. You've done fillings there, right? Okay, so it depends on the patient, but often we're looking for that opportunity. Now, Dr. Griffin mentioned same-day dentistry, and I know this is, again, that was then, this is now. 10, 15 years ago, if we said that same-day dentistry was going to become a very productive and profitable way to do business, we probably would have had widespread panic, okay? But same-day dentistry is incredibly powerful, and one of the easiest ways to begin offering same-day dentistry as your practice is to focus on preventive services same day. Okay, so same-day preventive procedures can be very, very effective and powerful. And I know sometimes this is how we feel. We feel like we're not only looking for the cheese, but we are the rat trapped in that wheel, and how is it possible to get it all done? And I agree very much with some of the things that Dr. Griffin said about systems and having a process and a place for everything, and how much more efficient we can be if we really put our minds to it. So we have hygienists doing same-day sealants all over the country, and they're doing them very, very well. Okay? All we need is 4 sealants a day on average. Okay? If we increase 4 sealants a day, that's another increase of more than $34,000 a year per hygienist. Now, we have many hygienists that are doing far more than 4 sealants a day. But if you haven't placed a sealant in years, okay, or if you currently aren't looking for those opportunities and you don't have a system in place for same-day service on sealants, that's my challenge to you. Just find 4. Find 4 sealants today that you can work in and begin that journey. Pretty soon you'll be like some of these providers. Our record number of sealants done in one day by a single hygienist is 82 sealants in one day. Now, if you beat that record, I would like to know about it. Okay? It's phenomenal. We get emails like this all the time from providers. I did 24 sealants on adult teeth. Today, just one day, 24 sealants. And this is the day after we had one of our coaches in this practice. So we have an immediate and powerful change. Here's another email. This email says, we just wanted to let you know that Tina hit a new high yesterday with her production. Her old record was $3,800. That's a great hygiene day, is it not? That's a fabulous hygiene day, especially given the fact that the national average is $600 to $800 a day. That's the national hygiene average. Her new production, she totally smoked it yesterday. She hit 57.17 in production. It was amazing how we all jumped on with same-day sealants. $2,000 of that production was sealants. Now, if this is the first you've heard me speak, or if you're new to this whole idea of maximizing these 3 roles, it's not uncommon for hygienists to come up to me afterwards and say, I don't believe it. It's not possible. I couldn't do that. Our practice is different. Our patients are different. But what I love is having that same provider come up to me a few months after being involved in our program and learning our systems and saying, I just had my first $3,000 day. We have systems that work regardless of where you are. We don't have to have a superstar hygienist to pull it off. Anybody can do it. And isn't that amazing? We have the potential to impact our practice in such a powerful way and really enhance the level of service to our patients in a powerful way. Okay, so when it comes down to it, Sealants is just, again, yet another service on the menu. One more that I want to share with you, desensitizing agents. And I could talk about preventive services all day long. I could go on for 8 hours of preventive services that you could offer your patients that will help to create that $5,700 day. It's not uncommon for me to have people call me. I did a call with Woody. I think the first time I did a call with Woody, he said, how is it possible that you're able to have these hygienists produce such amazing things at the end of the day? And my answer to that question is always, you know, it's not just one thing. It's a lot of little things that can add up to make a huge difference at the end of the day, at the end of the week, at the end of the month. It all adds up and can make a powerful difference. Desensitizing agents is another service that is underutilized in dentistry. So when we look at the number of patients that are struggling with this challenge, with this issue, it's a huge opportunity for us. But too often, we only utilize desensitizing agents underneath the resin material or during restorative. And maybe the reason we haven't offered it as a standalone procedure is that we really haven't found a product that will give us results that we're confident with. Okay, so we teach systems to maximize desensitizing agents. And you can tell by this microscopic view here that prior to us placing that desensitizing agent, those tubules are open, they're exposed. No wonder the patient has sensitive teeth. And then after we do a bonded service on that tooth, especially those exposed areas, it's an immediate powerful benefit. They don't have sensitivity anymore. Okay, so it's a viable procedure. And again, like I said, Gluma, Optibond, Solo, all of those types of desensitizing agents, those are designed to go underneath the resin. Be careful that you choose a product that has been proven to last a long time as a stand-alone desensitizing agent. Okay, I'm not talking about just a wet liquid that you rub on there. I'm talking about a bonded service. If you really want something that's going to work well, you need to do a bonded service for those exposed areas. Okay? Eventually, if we don't protect those areas, they're high risk for decay. Okay, they're also very sensitive. So what does this mean for hygiene profitability? Well, when we're paying attention, it can mean some very powerful things. Again, 4 teeth treated a day, just 4 teeth, on average is another increase of $34,000 a year. So if we add that to the potential just with fluoride and sealants, we're looking at a total of $103,000 in the next 12 months with just 3 services. And very low projections for those services, if you will. We have many providers doing far more than that. Okay, so again, it can be very, very powerful. Now, for those of you that have been here and you've been through the exhibits, we have a table out there, and on that table, there were 100 grand candy bars. That was not by accident, right? Because we've just shared with you just 3 simple strategies that can help you increase hygiene production by more than $100,000 in the next 12 months. Do we have more than that? Absolutely we do. There's a lot more that can be done to help you maximize your role as a preventive therapist. But in the interest of time, we're going to go ahead and continue our journey. Now, this is a quote from Joan Forrest of the Dawson Academy. Because again, in my mind, it's not about the $100,000. I get it. We are dentists and hygienists and clinicians because we want to help people. We want to serve people. But ultimately, at the end of the day, we are running a business. So we do have to look at the numbers occasionally. But again, the numbers are not what drive me. For me, it's all about taking the best possible care of our patients. And if the numbers happen to change at the end of the day, as we know they will, then that's just a side benefit of providing the best care possible. Okay, so can we have too much prevention? Commonly, I'm asked that question, but of course, we'll chuckle at that because it's a ridiculous question. Of course, we can't have too much prevention, especially if we know what happens when we take candy away from children.
And one more thing, on Monday night, I issued a challenge to the parents of America. I asked parents to pretend they ate all their kids' Halloween candy and videotape that and post it to YouTube under the heading, "Hey, Jimmy Kimmel, I told my kids I ate all their Halloween candy." And a lot of people did, and I guess I didn't expect so much crying. I kind of thought the kids would be just mad. Almost every one of them cries. But We got what we got, and to those children whose tears are about to be immortalized on television, I apologize in advance.
I'm gonna tell you what happened to your candy, Blake. I ate it all. I ate yours too, Alan.
Daddy, where's the candy?
What candy? We stayed up and we ate all your candies. Are you guys okay with that?
No!
Why?
No!
Natalie, calm down, Natalie.
Dad, you're ugly!
I ate all your candy. You have no more Halloween candy left.
What? She ate it. What the heck?
Don't you guys think you ate enough candy last night?
No, I only have like one bite of candy. Are you serious? Didn't you eat the rest? Oh, good for you. Now you're gonna probably get a bellyache. That's why you shouldn't eat so much candy. Mom, that's 2.
2 what?
2 bags of candy.
2 plus 2 equals 5.
You were so close. You see how much I had? I went to a lot of houses.
I know. I ate it all. It tasted so good, especially the peanut butter cups.
You sneaky mom!
Thanks to all the sneaky moms and sneaky dads.
Oh, I love it. Gets me every time. So obviously, if that's what happens when we take candy away from children, we're going to have plenty of work to do. We don't need to worry that having a very effective and proactive preventive program is going to affect our restorative treatment in any way, shape, or form. Okay? So I want to spend just a few minutes talking about our role as a periodontal therapist and looking at that was then and this is now when it comes to periotherapy. Okay, there's a lot of things that have changed over the years, and too often we find that practices are still treating periodontal disease today the same way that they have for 10, 15, even 5 years. And the reason that this is concerning to me is because of everything we now know about perio. What we know about periodontal disease today is very, very different than what we knew about it 20 years ago when I graduated from hygiene school. So often, how we were taught to go about treating periodontal disease is not the best way to do it today. Now, again, this is another full-day course, and I wish we could talk about this all day long, but we can't. So I'm just going to try and touch on a few key things that I think are very important for you to consider when it comes to periodontal practice or periodontal therapy in your practice. So too often, when we first analyze an audit, this is an area of weakness, and many of us know that. We know it's an area of weakness, but some of us may have had a bad experience when we had a soft tissue management craze, as I call it, in the early 90s, where we went a little bit overboard on soft tissue management and we ended up driving a lot of patients away. There's a delicate balance, isn't there? A delicate balance between going after periodontal disease and treating it as the serious condition it is and being too aggressive. Okay, so when we look at periodontal audits, it's surprising to me what we find. So I'm going to share with you a few examples. Now, the image on the bottom, the green is patients not in perio, and the orange is the percentage of patients in perio that this doctor feels they should have if they were following his standard or her standard of care. Now, this practice that I'm sharing this, they give me permission to share their example with you, their audit with you, is a very highly productive, highly sophisticated practice. They have 15 treatment suites. They're downtown Washington, D.C., and last year they did $9 million in production out of one location. Highly sophisticated practice. The percentage of their patients that are actually in periodontal therapy, can you throw that up there again, is only 3.5%. The doctor thinks it should be 40%. Very big variation between reality and perception, yes? And this is not uncommon. We find it all the time. Oh, I'm sorry, was that 1.5%? I showed you the wrong one. So this is 1.5%. So again, this is the practice that's highly sophisticated. They were at 3.5%. Okay, it's not uncommon for us to really be performing poorly in this area when it comes to perio, often because we're coming at this from a state of fear. Okay, so what we know about perio today is really important for us to review. And if you feel this way about any of these common frustrations, it might explain why often your perio actual percentage of patients involved in periodontal therapy can be low. Common frustrations that we see: it's difficult to get hygiene providers to change. It's difficult to get everybody on the same page. We've adapted our strategies. We talk a good talk in dentistry. We say we refuse to allow insurance to dictate the level of treatment we provide our patients. But when it really comes down to it, especially with perio, we allow insurance companies to dictate the level of care that we give our patients. Because if it's not covered by insurance, most likely we're not even offering it. We're not talking about it. Okay? Now, again, I'm using generalizations, but this is what we see. This is a very common thing that we see. Those who really need more than a regular prophy often are still just getting a prophy, because it's easier to put our heads down and get the work done than to stop and have that difficult conversation, especially with those patients that have been coming every 6 months for years. Okay, but the whole that was then, this is now. It used to be with perio, we'd wait until it got worse and then refer, right? Now, what do we know about perio? It's really important to try and eliminate the cause of the infection at the very earliest possible stage, before too much bone has been lost. Okay, and it's also really important to realize, if we ignore perio, is it going to go away? Is it going to go away? If we ignore periodontal disease and wish it away and prefer not to deal with it, there could be potentially disastrous consequences. Okay, so it is really important. It used to be just about saving teeth, but now we know it's much more serious than that, right? It's about saving lives. The oral systemic link, the American Academy of Oral Systemic Health is becoming more prevalent. In fact, you can actually sign up for that while you're here. Okay, so we have mountains of research connecting links between periodontal disease and other serious risks to patients' health. And in your handouts, I've spelled out some of the more compelling recent studies about some of these potential serious consequences of having periodontal infection in the body. But because of time, I'm not going to go through each one of those, but I did provide you that information if you would like to review it. Now, we have just added 28 slides documenting current scientific research that connects periodontal infection and systemic health risks. So it is serious. We have to pay attention to it. If you have a low percentage of periodontal services being done, one thing we have found is the problem is often not that we don't realize this patient needs periodontal therapy, but the challenge that I see most providers running into is getting the patient to say, yes, I want that. Too often they're saying, hey, can't I just have the regular cleaning? Can't I just have the free one? Right? That's what we're getting. So that tells me something's broken in your case acceptance protocol, okay, and how you're explaining these services. And not only do I know that because that's what I see, but all over the internet, there's questions that come up like this. What exactly is a debridement? Sounds like a deep cleaning to me. Went to one dentist. He said I needed a deep cleaning. He never said you have periodontal disease. Went for a second opinion and was told I have periodontal disease, need debridement, scaling, planing, 3 fillings and a crown for crack filling.